Black River Medical Center is unique because it was a net new hospital that was built using state-of-the-art technology in a rural community in South Carolina. A lot of rural communities are actually shutting down hospitals currently, and MUSC invested in building a state-of-the-art facility to offer access to highly specialized care right there within the community.
It's really hard for community hospitals to provide all the services that larger organizations provide. And this hospital was built to be a community hospital and to be appropriate for the community, but with all the access to an academic medical center and MUSC's resources throughout the state. When we were planning this hospital, our mission was to bring two communities together. This hospital, which was the vision of our legislative team, was to create a facility that could serve both communities. And it's done really well at that. I think both communities have really stood by this hospital and supported it. The care team that's here, the vast majority of the folks live here in this community, and they take care of their friends and neighbors, and it's more than just a billboard here, it's a reality.
So historically in rural communities with staffing issues, it's been very challenging to have a provider in-house or get real-time answers 24/7. But telehealth solves that problem by giving access to both the staff, the patients, their families, access to providers 24/7.
And Kim, when you press on that spot, is it reproducible at all?
Does that hurt when she's pressing on there?
Since 2019, I've been the medical director of the telehospitalist service. Any patient that gets admitted to the hospital would be seen by our team. So we work with on-site staff and providers, nurse practitioners locally, and we provide direct video rounds as well as set telephone check-ins and additional coverage 24/7 on all admitted patients to the hospital. So essentially, if you get admitted to Black River, a local nurse practitioner on the ground will see you, as well as a virtual physician that's usually located in Charleston. We use a program called Teledoc as our video platform to communicate in real time with patients. We have these high-tech mobile carts. They have high-definition cameras with zooming and magnifying capabilities. They're Wi-Fi enabled, and of course they're mobile, so we can take them room to room. We also have electronic stethoscopes which allow us to listen to a patient remotely, both their heart and lung sounds. And from a provider standpoint, we have access to the electronic medical record in real time. So all the diagnostics, all the imaging, and all the lab results are available in real time, just as if we're standing bedside there.
We're on the cusp of telehealth. The possibilities are really endless. The idea is to get all of the specialties and all of the great minds and the resources that MUSC has across the state available to a rural community.
Telehealth is able to help improve outcomes for patients in rural communities simply by offering access to specialized care directly into the community. Historically, patients would have to be transferred to get access to specialty care, and transfers are difficult on patients, certainly the patient, but also the family, to have to go to a bigger city to be seen by a psychiatrist or an infectious diseases doctor. So keeping patients local in their community is better for the patient. It shortens the length of stay, frankly, and doesn't require a transfer to a different facility, and also offers really support for the local team to offer that expert care. Williamsburg County is not different than other rural communities across the country, really. And so Black River Medical Center is a great model for how you can leverage remote specialists to really bring highly specialized, high quality care into rural communities that otherwise would not have had access to such care.
Rural hospitals make up about 35% of all hospitals in the nation, but only about 10% of physicians practice in those hospitals. So there's an inherent shortage of staffing in all these hospitals. Additionally, South Carolina has about 27% of its residents living in rural areas. So there's a need in our state alone to support these hospitals.
Let's take a look at some of your home medications.
In a time when rural hospitals across the nation are closing, I think since 2010 there's been 136 closures, 6 alone in the state of South Carolina. What MUSC has done at Black River is truly remarkable. MUSC is building a brand new rural hospital and it's thriving. So I think using the telehealth model is a template for rural health viability, not just in South Carolina, but hopefully nationwide.